Video I'm going to discuss a Baker cyst behind the knee, and then what are some treatments that you can do at home to try to improve your range of motion and strength. So we're talking about a Baker cyst. What that is also known as a popliteal cyst that occurs on the back of the knee. This can be painful and can affect your ability to flex your knee. That's going to be bringing your foot towards your buttock region. And so bending, squatting down, lunging, those types of things can be very painful and uncomfortable, as well as walking. You may notice when you walk that your knee doesn't want to extend all the way. You may have increased muscle tone and tension that forms in the back of the knee, the hamstrings, or in the calf muscle, this area. And so with these techniques that we're going to go through, this is not all inclusive, but these are some things that you can do at home in cases where you're trying to go conservative, because in some cases this needs to be aspirated and or surgically removed. The first thing we're going to do is going to be a hamstring and calf stretch. And so I'm just going to put my leg up here. I'm going to pull my foot and toes back to me at the same time I feel this stretch in the back of my leg, and then I'm going to lean forwards towards my toes, and I really feel that pull. Now initially I wouldn't go too aggressive with that, just a nice slow stretch, again kind of activating those what's called dorsiflexors on the top of the shin, pulling the toes back. You can also contract your thigh, your quad a little bit. That's going to help with something called reciprocal inhibition. So that can improve a little bit of that stretch that's going on. So I'm tightening up my thigh, and I'm also tightening up this shin muscle right here on the front, pulling my foot back. And I'm going to hold this somewhere between 15, maybe 30 seconds, several times a day. If it's too painful and you can't get your knee flat, just go down as far as you can. Still do the same thing. Tighten up the thigh a little bit, tighten up this muscle, pull your foot and toes back up towards you, and then just apply that stretch. You can also use one of those stretch out straps or a towel. You can put that around the ball of the foot and pull that back to you to add an additional stretch. But again, initially, that may be a little too much, and you may just need to start very basic, just letting your foot or leg in this, lie in this position. Now, if you don't have a ball, you don't have to use a ball. You can just put your foot flat on the floor and then just lean in towards your foot, bending over, stretching that back side of the knee and the back of the hamstring and everything. That works just the same. It's just preference as to which one you want to do. Now we're going to perform heel slides, and I've got one of these stretch out straps here. I'll put a link in the description. And so I'm just going to kind of use this to help slide my heel back. I'm going to go as far as I can and then back down, because remember, a lot of times this is very limited for you to be able to to bend your knee here. So I'm just going to kind of pull it back nice and slow and come back down. And I would complete a couple of sets of maybe 15 to 20 repetitions with that a few times a day. The next exercise we're going to perform are seated leg extensions. So I have a 4-pound cuff weight on the bottom of my leg here. And so I'm just going to kick this out, pull my toes back, and tighten up my thigh. That's kind of the tip I like to give my patients. I like to tell them to pull their foot back at the same time they're tightening up their thigh. To me, it just seems like a better contraction. I don't have any evidence right now to support that, yes, that is more effective than not pulling your foot back, but I personally feel like I feel it more, and my patients also say that they feel it more. So I'm going to kick that out as far as I can, pull my toes back, hold that maybe for 1 to 2 seconds, and then come right back down, nice, slow, and controlled. And I would complete 2 to 3 sets of 10 to 12 repetitions 1 time a day. We're now going to perform also seated hip flexion exercise with a cuff weight. And so I'm going to bring my leg straight up and down, kind of keeping my knee bent a little bit here with that 4-pound cuff weight on. And I'm going to complete 2 to 3 sets of 10 to 12 repetitions. Another thing that I recommend a lot of my patients to do is apply a moist heating pad or some sort of moist warm compress in the back of the knee, several times a day, just to try to increase the blood flow that area and just to give some pain relief and try to reduce some of the muscle tension that's going on. Thanks for watching.